Hi, my name is Dr. Jothi Kumar. I'm an obstetrician and gynecologist with a special interest in fertility and IVF treatment. When the couple sees a fertility specialist, what they should expect is a few things. First of all, we'll take the female side. A very good history has to be taken to identify the main issues. For example, in female, the main underlying cause can be an ovulation problem, and you can ask a history. If they're very irregular periods, it's likely that ovulation is the problem. Secondly, history of, like I said, very severe pain during their periods may indicate endometriosis. So a good history is important. In women, for example, as I mentioned earlier, ovulation is the main problem, but it could be possible that their fallopian tubes may have been damaged. So when you take a history, for example, if they had a history of some pelvic infection, or they had appendicitis because the appendix is very close to the right tube, or they have very bad vaginal discharge with fever, this may indicate that the tube may be damaged, and therefore the patency of the tube may have to be tested earlier. So a good history is important. And then a physical examination, that you look for very obvious things like thyroid problems, you can examine them, and most importantly, it's a pelvic examination, a pelvic scan, because we can look at the uterus, the ovaries, and look for major cysts, problems like fibroids, cysts, and you can identify all of this during a pelvic scan. So a good history and physical examination is important. Then, based on what we find, we'll do basic tests, which I'll come to later. In the male, for example, most of the time a semen analysis is what is normally done. But if they already had a semen analysis, then we need to take the history, for example, as to what could be the cause of their sperm problem. Did he have mumps when he was young? Because the mumps virus actually destroys the sperm cells. Is he a heavy smoker, for example? Because nicotine and other substances can affect the sperm. And even issues like, for example, any erection or ejaculation problems. So these are questions that we ask in the history. Examination of the male usually is not done the first time. If there's some problem with your sperm, for example, low count, low motility, then we will examine the male. We'll look at the size of the testis, we can feel whether the vas deferens is blocked or palpable, and another condition called varicocele with extended veins. All this can be identified during examination. So during the first visit, a good history, a physical examination, and some relevant tests are usually what you can expect to happen. Okay, having taken a good history and a physical examination and done the basic ultrasound examinations, then certain blood tests would need to be done. So as far as the female is concerned, the most important test is to assess her ovarian reserve. That means a rough assessment of how many eggs are there in her ovaries. Because as we know, eggs are fixed at birth and they don't increase and they decrease with age. So a blood test which includes hormonal profile, FSH, LH, estradiol, testosterone, prolactin, and also a very important hormone called AMH, anti-Mullerian hormone, which is a good indicator of the number of eggs. These are some of the blood tests that can be done. Sometimes if you suspect the tube may have been damaged, then a HSG will be ordered, called a hysterosalpingogram. It's a radiological examination. It's a very simple examination where the radiologist will inject a dye and take an X-ray and see whether the dye actually flows through the fallopian tubes. So this is what basically the basic investigations are done for the female. For the male, a semen analysis. The semen analysis is based on the WHO criteria of looking at the parameters related to the density, the count, the percentage moving, and what percentage looks normal, the shape of the sperm. So these are the basic investigations that are done for the male and female during the first visit.